Up Close with Chris Williams is presented by Tennova Healthcare, with 6 hospitals and more than 1,000 dedicated physicians. For more information, tennova.com.
Welcome to Up Close. I'm Chris Williams. It appears to be more common every day for people to have a friend or family member who undergoes joint replacement surgery. What exactly is joint replacement surgery, and when is it necessary? On this show, you will learn more about these procedures. Dr. Matthew Nadaud is a joint replacement specialist and orthopedic surgeon. When our crew visited with him recently, I first wanted to learn about him. So I asked about his background, education, and his credentials. Let's go back first of all and let our viewers get to know a little bit about you. Tell me about your childhood and where you spent your early days.
Well, I was born and raised in Toledo, Ohio, and I have 6 brothers and 1 sister, and it was always exciting.
So a large family.
Definitely.
So tell me about, I guess, credentials, where you went to college, med school, and all those great things.
I left Toledo to go to Miami of Ohio, Miami University,
Right.
Where I met my wife. And after college, I went to Medical College of Ohio back in Toledo. And then I went to do my residency in Akron, Ohio. And after that, I decided I wanted to change in latitude, and I moved to Charlotte for a fellowship where I did my specialty training for hip and knee surgery.
What actually led you to Tennessee?
Just a wonderful opportunity. Again, change in latitude was attractive, but a friend of mine had joined a group in Knoxville, and they were looking for someone to specialize in hip and knee replacement, and it was just a great opportunity to move here and bring my family here. It's been a great decision.
Let's talk about that. At what point did the interest in orthopedics develop? Was that something that maybe happened over time, or was it something that you happened upon while you were in college, or where did that interest come from?
I think I developed an interest in medicine very early on. My father was a family practice doctor in a small community in Toledo. He practiced on the same street for over 40 years, and I just loved what my dad did, and I loved his involvement with the community, and I think I knew then that I was going into some sort of medicine.
Let's talk about your field, because there's so much information, constantly evolving sometimes, changing. How do you stay abreast of all the types of procedures that are available and all the things going on in your field?
Well, my field has been narrowed to hip and knee replacement surgery. So I stay abreast by participating in educational meetings. We have a national meeting that goes on for a week every year that many of us are able to attend. And then there are specialty meetings that we can attend, educational labs and workshops we can attend through the Orthopedic Learning Center in Chicago. And almost any weekend you could attend an educational meeting. Our board requires a maintenance of certification. So not only do we attend courses, but we actually take tests and maintain that educational aspect.
You have been involved, and I understand, a lot of research in your field. Tell me about some of the research maybe that you've done.
I got involved with research first as a medical student, and was able to participate in some research as a resident as well, doing research predominantly on hip and knee replacement once I decided that was going to be my area of focus. And during my residency, where I did some extra training in that area, I worked with some people in Charlotte who really have a wonderful lab and a research department, so I was able to pursue that through them. And once I got into practice myself, I was able to participate in a few other studies.
Now, you've also been involved with some teaching. Tell me about that. Is that something that you enjoy doing?
It is something that I enjoy doing in a clinical setting, kind of like the research I've had a chance to participate in. I wanted to do things that had clinical meaning, that helped make clinical decisions. So we've had physicians in, and through design of implants, through the use of different instruments, I've gotten to participate in some teaching opportunities that way.
Well, I have to ask you about something that I feel like a lot of people will find interesting in Tennessee. I know that the practice you are a part of is closely involved with the University of Tennessee athletics.
Definitely.
Will you tell me a little bit about that history and maybe what the partnership or the working together has been like?
Some of my partners are specialists in sports medicine, so they do special training when they're done with their residency programs, and they are really committed and dedicated to that area, and they've had the opportunity to work with the UT athletic department and care for their athletes.
Very interesting. Probably everybody at home right now knows someone who has suffered from arthritis. How common is that in the United States today?
It's terribly common. The adult population, patients above, or I should say, people above 65,
Right.
probably 80% of them have some arthritis. Overall, 1 in 3 adults will suffer from arthritis. It's a terribly debilitating disease.
A very broad question for you, because I know there are probably so many different aspects to this, but what are some of the most common treatments that you're able to offer for those who suffer from arthritis?
Well, starting with the basic things. The easiest things patients can do for themselves, and we always recommend, are maintenance of ideal body weight and encouraging patients to exercise. There's good research out there to show that exercise can help patients tolerate their arthritis, can in some cases slow the progression of arthritis.
Are there surgeries that people can have?
There are certainly surgeries. That's certainly not the first tool we reach for, but we encourage lifestyle changes and things patients can do for themselves. There are also many medical prescriptions in terms of over-the-counter medications. Prescription medications for anti-inflammatories are among the most commonly used medications. And then surgeries.
When it does get to the point of surgery, how successful is that typically for someone who, is there a success rate available on people who actually have surgery for arthritis?
Most hip and knee replacement patients, and again, that's where I tend to focus on those sorts of questions. Most hip and knee replacement patients get tremendous relief of their pain with the surgery. Most of them are very successful. And for the durability of joint replacements, we expect 90% of them to be functioning well after 10 years. And with current implants and the current techniques, we expect 80% of joint replacement patients really to be functioning well after 20 years of use.
Excellent. I want to take those two separately because, as you well know in your field, two of the most common joint replacements are hip and knee. And it seems like probably everybody knows someone who's had that type of surgery, somebody in their life. So let's take, first of all, the hip replacement. When is total hip replacement surgery necessary?
Well, generally when it's compromising the patient's lifestyle to an extent that they're not comfortable with. An arthritic hip causes pain, and that's the primary problem, is pain. But it also can limit mobility. It can keep people from participating in activities, from activities of daily living for some patients to limiting activity in their job or their recreational activities.
What actually takes place when you do get that type of transplant?
Well, a hip that becomes arthritic loses the cartilage between the ball and the socket, or
Right.
the cartilage on the ball and the cartilage on the socket, and that becomes worn. And the hip replacement will replace that ball and socket with artificial bearing surfaces.
And after the surgery, how do you determine what is successful?
Well, number one, we look for the patient to have pain relief.
Right.
And that's the primary measure. We also hope that they resume their functional levels, hopefully see improvement in their function, reduction in their pain.
Let's talk about the function level. What is that recovery time like? Because I've seen both cases. I've seen somebody who, like 2.5 weeks later after hip surgery, they were ready to go, which I thought was, not probably common. But then also knew somebody that it took several weeks to get back to a general routine. So what is that average
Sure.
time?
It depends on what the patient can do before surgery. Our younger patients or active patients, even patients in their 60s and 70s, if they have a high activity level before surgery, many of them can go home the next day. They have certain precautions and certain exercises we ask them to do, but we get patients up within hours of surgery. We get them walking with a physical therapist, and patients who present with a high activity level will get along fairly quickly. Patients who are more sedentary, patients who have more impairment of their mobility, they may take several weeks and really take a couple of months to get back up to speed.
So if someone is considering having hip surgery and hip replacement, what should they really look for when they're looking for someone to help them with that? What characteristics should they look for in a surgeon?
Well, they need to find someone that they can work with, clearly. They need to have someone they communicate well with, and I think that goes without saying. Hopefully they can ask their friends, they can search out someone who hopefully is a specialist in that area, who can provide expert opinions and expert advice on when that's an appropriate step for them to take.
Can it be difficult sometimes to maybe put that in layman's terms so that they actually understand what they're going to be going through?
It can be a challenge for some patients. Many patients, because arthritis is so common, many of them have seen family members, friends from church, neighbors, they've seen patients go through this before. So they become very familiar with it. And most patients are very well versed, but we provide a lot of educational materials. We provide a preoperative classroom,
Right.
where they have an educational seminar, and they go through the teaching materials and they learn not just about their surgery, but what to expect before and after.
Changing gears here, we talked about the hip surgery. Let's talk about knee surgery. Is there an option available besides total knee replacement?
Sure. The extent of the arthritis can really dictate what's the appropriate step for any given patient. Certainly, the goal again is to alleviate their pain, and it depends how much dysfunction they have and how much pain they have. So, short of doing a knee replacement, some patients could have an arthroscopic procedure that may help them postpone any sort of implant surgery. A large percentage of patients who have advanced arthritis may still be candidates to have a partial knee replacement.
When you distinguish between the two, I guess some people come to you and it's arthritis, it's a problem, but also sometimes injury plays a role where they actually need the surgery. Will you tell me about maybe the difference in the two and how common each of those are?
Sure. In the area of arthritis, oftentimes an injury is a precursor to developing arthritis down the road. In some cases, if the injury was severe, they end up with what we call post-traumatic arthritis. If someone had a fracture or a particular injury to their hip or knee, that can result in arthritis down the road. in less common circumstances, an acute trauma can lead to the need for a joint replacement.
Is there an average age of patient that you see?
Well, there's certainly an average, but the range of patients undergoing joint replacement surgery is quite large. We see patients with congenital problems or juvenile rheumatoid arthritis even as young as teenagers, and other patients up into their 90s. We had a gentleman yesterday was just telling me he's looking forward to getting back on the golf course after having his partial knee replacement. He's 90 years old and he golfs 3 to 5 days a week.
Very interesting. What is the recovery period after knee surgery?
Again, it depends on the patient's activity level beforehand.
Right.
But overall, it takes those tissues around the knee months to fully recover. With knee replacement surgery, we start therapy, again, the day we operate on the patient. They may get up, they can put all their weight on their knee that day. They may be sore and stiff, but we'll do therapy for a couple of months. Most of them spend 2 or maybe 3 days in the hospital, and they progress with outpatient therapy. And depending on their activity level, they increase things at home as much as they tolerate.
You mentioned a moment ago, it's important that the prospective patient finds someone they can trust. This is really like a relationship, isn't it? Because first of all, the patient has to be educated on what's necessary. Then you do the procedure, and then the follow-up is there, the recovery. So this isn't like coming in one time, getting something done, and then you're finished, is it?
Definitely not. This is definitely a team approach. So we may not be the sports doctors, but we're definitely teaming up for this operation. And we count on the patients to take ownership of it. We count on the nursing care at the hospital. We count on the physical therapists and participation of the patient in that therapy to make sure that they get the best outcome.
You mentioned team. What type of team do you have that you work with in the process?
I've got a wonderful group of people around me that sure make my practice and my job more enjoyable and easier. We all have to do our part, from the office staff and getting the patients educated, and taking care of the patients at the office. And then at the hospital, we've got a very specialized team of technicians who know our instruments inside and out and know our surgeries inside and out, people that I can trust to get through that operation and make it a very nice working environment, as well as a group of experts all doing their part to perform the operation. After surgery, we have specialized orthopedic nurses, we have physical therapists with great experience and just the right bedside manner to push the patients to get the most out of them.
Let's talk about both sides of the spectrum. What is the greatest thing that can happen with a patient? And then if there are complications or problems, what is the most challenging, or what could possibly happen that wouldn't be great?
The greatest thing is that the patient gets pain relief and the patient is pleased with their result and they get to return to the activities that they were missing out on. We have a wonderful collection of pictures and postcards that patients have sent us, just thanking us for getting them back to some of those activities. And they send us pictures of from everywhere, from their garden to the top of Mount LeConte, and to show us that they've really gotten back into those activities. So that's one of the most satisfying things we can do, is just to have that effect on someone, to keep them doing the things that they enjoy. On the other hand, there are the rare complications that can be a significant setback, things people may be aware of, or the types of problems patients ask about. Commonly with joint replacement, we're concerned about the risk of an infection or the risk of a blood clot. Now, there are certainly protocols and very well studied means to minimize those risks, and we make sure we stick to all the best practices to make sure we prevent those. But unfortunately, with this type of surgery, as proficient as many institutions are at making joint replacement seem like it's not a big operation, it really still is. And if a patient gets one of those complications, we do need to have special medical care, sometimes even requiring further surgery.
I met several of your team members here before we started talking. Very nice people. And I would imagine there's a lot of pride in the fact that when you have someone come back to you and you basically given them their life back in many ways, if they were restricted before surgery, I guess there's a lot of pride in that on behalf of you and your team, isn't there?
Absolutely, and pride and satisfaction. And really that's why I got into joint replacement surgery. That's what drew me into it. In my residency, we get to do all different types of orthopedic surgery, but I was drawn to joint replacement because of the patients, because of the results, and it's tangible. You can see the patients recover, and you get to experience that with them. And from a technical side, it's a wonderful operation as well. But yeah, the patient results and seeing them recover is wonderful.
In joint replacement, are you able to explain what actually happens in that process?
Sure. I can actually show you some models. Excellent. If you like.
Excellent.
So this is a knee replacement, and just an example of how we enter the knee and replace the worn surfaces on the knee. So this is a knee replacement where a cap has been placed on the femur. This is the femoral component, and that resurfaces the end of the femur. And a metal tray gets cemented on top of the tibia, so this surface in surgery gets resected, and we place this metal tray here. This plastic bushing is like the new cartilage for that patient. Wow. So these surfaces can then articulate, and we've eliminated those worn surfaces that were causing the pain and discomfort.
Once you determine that it is necessary, is there usually a waiting period, or are you able to pretty much schedule that as soon as possible for a patient?
Well, they're generally not emergencies because most of them don't occur because of trauma. It's usually a wear and tear type of problem. So when we schedule our patients for surgery, generally there's a waiting time of a month or so to get them ready for surgery. We encourage them to do some preoperative exercising. Sometimes we send them to physical therapy pre-op, but it also gives us a chance to make sure we have them stable and ready from their other medical issues. So we'll often ask the primary care doctor to see them, and they go through a battery of tests depending on their other medical issues to get ready for the operation.
Something struck me a moment ago when you were talking about the content of implants. And I'm just wondering, when you get one of these transplants, what is the likelihood that you could actually set off the security system at the airport?
That's a great question, and you probably will set off the security system. In the newer airports with the body scanners, that's been wonderful for joint replacement patients because they don't have to get sent to a special line. So they like the body scanners. But with a traditional metal detector, most hip and knee replacements will set that off.
Very interesting. You have been involved in this since 2001. What are some of the many changes that you personally have seen in the field since then?
We've seen a lot of changes since 2001. The most important change I think we've seen is in pain management, and the realization that we can really get patients moving very quickly. So different techniques have come about in terms of smaller incisions and smaller instruments, and that's created a lot of hype and excitement about it. But truly the part that I think that has made the biggest difference for the patients is improved pain management, and we're able to get them moving more quickly and get them comfortable more quickly and shorten hospital stays.
Okay. I wanted to ask you in closing, what do you think makes for a good orthopedic surgeon? What characteristics should they have?
Well, hopefully someone who's passionate about what they're doing, someone who cares for the patient, someone who wants to make, who wants to see that patient succeed. So that's a great starting point. After that, I think someone whose practice is dedicated to hip and knee replacement, if that's what the patient requires. Someone who's surrounded by great people,
a good team,
like I'm fortunate enough to have, and someone who can talk the patient through the process, someone who can help get that patient ready and prepare for a successful outcome.
Excellent. Thank you so much for visiting with me. A real pleasure.
It's absolutely my pleasure. Thank you.
After seeing this interview, I hope you at home will be more aware of joint replacement procedures, a viable option for many. A special thanks to Dr. Nadaud and his team for their assistance with this show. And a special thanks to you at home for watching. Up close, I'm Chris Williams.
Up Close with Chris Williams is presented by Tennova Healthcare, with 6 hospitals and more than 1,000 dedicated physicians. For more information, tennova.com.